There is a persistent myth in behavioral health that a highly skilled counselor operates independently, fully equipped to solve any clinical puzzle on their own. The reality of clinical practice is much different. Every practitioner possesses inherent blind spots and encounters cases with constantly shifting variables that exceed their limits. Exposing clinical uncertainties to colleagues demonstrates professional competence. To navigate these complexities, the profession relies on two distinct structural scaffolds: consultation and clinical supervision. Beyond external guidance, a counselor's personal well-being functions as a critical component of professional capability. Combined, these elements form the broader professional responsibilities required to sustain a career over decades. Safe, ethical practice is structurally impossible in total isolation. It requires an active commitment to collaborative safety nets to protect clients. Consultation is the specific process of seeking input from peers, supervisors, or outside professionals to resolve an isolated clinical question. You connect, exchange specific information, and apply that input to your case. Specific triggers make consultation necessary, like a complex co-occurring disorder or a clinical impasse. It's also required when navigating an ethical dilemma or when needing clarity on confidentiality rules. Consultation is necessary when you experience a strong personal reaction to a client or face a scenario outside your prior experience. Successfully integrating this advice requires an understanding of the terminology and roles of other professional disciplines, so you can translate their input into your own practice. Because counseling often happens within multidisciplinary teams, this dynamic is reciprocal. You must both seek clinical insights and contribute them. During these exchanges, you must adhere strictly to confidentiality rules, securing appropriate client consent before sharing any identifying information. Documenting significant consultations serves a dual purpose. It protects you from liability and provides a record of sound clinical reasoning. Proactively consulting a colleague before acting on uncertainty prevents critical clinical errors. If consultation is horizontal, clinical supervision is a vertical professional relationship. It is an ongoing structure designed to develop a counselor's skills while actively monitoring the quality of client care. This is distinct from administrative supervision. While the two may occasionally overlap, administrative supervision is strictly concerned with job performance, budgets, and agency operations. True clinical supervision serves three simultaneous functions: developmental, supportive, and accountability. The developmental function builds clinical competence, expanding a counselor's knowledge base over time. The supportive function sustains the counselor's morale and helps recognize signs of emotional strain. The accountability function serves as a quality assurance mechanism, guaranteeing that clients receive safe and legally compliant care. This relationship provides a safe environment to surface countertransference and examine difficult cases before they escalate. Clinical supervision acts as the foundational safety architecture that ensures all ethical vulnerabilities are safely managed in a controlled environment. To guide counselor growth, supervisors utilize two distinct but complementary types of evaluation. The first is formative evaluation. This is the continuous feedback provided to help a counselor navigate developmental progress and make micro-adjustments in their practice. The second is summative evaluation, a periodic, formal checkpoint used to assess a counselor's overall competence and performance. Effective supervision aligns this growth with the mission of the agency where the counselor works. It also ensures alignment with national credentialing frameworks, specifically the TAP 21 competencies and ICNRC standards. This supervisory structure adapts to the clinician's tenure, providing rigid structure for novices and evolving into greater autonomy as competence matures. Evaluation is a structured pathway ensuring a counselor safely transitions from novice to experienced practitioner. Sustaining clinical competence over time depends on the counselor's own physical and emotional health. The work carries severe occupational hazards. The first is burnout, characterized by emotional exhaustion, cynicism, and a reduced sense of accomplishment. The second hazard is compassion fatigue, which is the gradual erosion of empathy caused by constant exposure to distress. The third is vicarious traumatic stress, where the counselor develops trauma symptoms from hearing and absorbing their clients' experiences. For counselors who are themselves in recovery, these hazards present specific vulnerabilities, as the work can directly touch personal history. Maintaining firm boundaries and utilizing peer support are professional responsibilities required to prevent burnout. Failing to maintain this health leads to impairment, a condition that actively compromises safe practice and constitutes a severe ethical violation. A depleted counselor cannot provide safe care. Active self-monitoring is a critical component of ethical client protection. To get the most from supervision, counselors must intentionally bring their raw clinical struggles to the table rather than presenting only their successes. This requires receiving feedback non-defensively and following through on agreed-upon supervisory actions. Hiding early signs of stress or treating supervision as a mere formality increases the risk of harm to both the client and the counselor. Professional responsibility includes lifelong continuing education to stay current with changing laws, regulations, and best practices. You have an ethical requirement to represent your qualifications honestly and adhere strictly to the renewal requirements of your specific credential. For CDCA candidates, this credential represents one stage of a developmental pathway that requires further education and clinical experience to advance. Professional development is a lifelong process. The most competent counselors are those who remain willing to learn, adapt, and critically reflect on their own practice.